One of the hospitals in the UK had several ambulances in a queue, and a few were even circling, waiting for their turn. This had become business as usual. Within a span of just a few months, it went from having hardly any ambulances that were waiting to several of them at any time. This was the result of a decision taken a few months ago. A decision which had the right intent but was wrongly executed. Hi, I am Dr. Mohan, and this is a true story about the dark side of KPIs. A few months ago, the head of emergency and accident department of a hospital in London wanted to improve customer satisfaction. So he started taking customer feedback. There were no surprises. Patients wanted to see the doctor as soon as possible. This would speed up everything else and hence raise customer satisfaction. So the hospital management came up with a new KPI. How quickly the nursing staff could take a patient from getting registered to seeing a doctor. The department was receiving two kinds of patients. Firstly, there were the ones who walked in with minor sports injuries, and secondly, there were the critical ones arriving in ambulances. The nursing staff soon realized that they could not stop the walk-in patients with minor sports injuries from registering. And as per the new KPI, the moment they get registered, they become a priority for everyone. Also, the ones arriving in ambulances could be made to wait by simply asking the ambulances team of paramedics for a favor. The nursing staff thus began asking the paramedics to leave their patients in ambulance until a house doctor was ready to see them, thus able to improve the KPI. Since then, the parking lot was always full of ambulances and some were even circling the hospital. This created a major problem for the ambulance service, which was unable to deliver any emergency service. More importantly, the new KPI had an opposite effect. The patients with minor sports injuries were getting prioritized over the critical ones simply because they could not be stopped from registering. This is not a one-off story. If you look close enough, almost every KPI has a dark side. Does it happen in your organization or department? What kind of approach would you recommend?